Well, every week we like to bring you useful information in medical rounds, and today we're talking about a new program to help young adults who are coping with mental health issues. Dr. David Bendor, a clinical coordinator of the Young Adult Services Medical Track at the Institute of Living, is now here to tell us more about the program. Welcome, Dr. Bendor. Thank you for being here.
Well, Kara, thank you for having me. This is something I'm definitely excited to talk about.
Yeah, we're learning more about this program, and it's unique, and we understand that it's not like any other in New England. Can you tell us more?
Yeah, so this is a program that we treat young adults who are struggling with mental health conditions, and there are many programs like that in New England and in the country. Where we're unique is we're looking only for young adults with co-occurring physical health conditions such as diabetes, Crohn's disease, cancer, seizure disorders. So they have both situations they're facing. They have mental health conditions as well as chronic physical conditions.
And why is this kind of unique program so important, do you think?
Just the other day, I presented this program to some colleagues of mine, and one of my physician friends came up to me. He said, Dave, this is so important. And the demand is only going to grow because of advances we have in medicine and technology, that we have young people who are surviving and thriving in ways that we would never have imagined 20, 30, 40 years ago. And so we're having more and more young people who are going through life with chronic medical conditions, and we have ways to help them enjoy life and embrace life in ways they never could before. A lot of programs that treat the mental health but don't address the physical health will see that one exacerbates the other, and they never really get a handle on either.
And so what are some of the mental health challenges that you're seeing that your patients are facing?
So often, like many young adults, we see coming in the door, we see depression and anxiety. Those seem to be the most common. What's unique to this population is the amount of trauma we're seeing, and traumatic disorders such as PTSD. Because if you think about it, we have young people who are given, very dangerous and frightening diagnoses at young ages. They have often aggressive treatments that, while life-saving, can be very traumatic. Significant multiple surgeries, painful rehabilitation, and physical therapy. So they've experienced a lot of trauma that even their peers with anxiety, depression just never experienced or went through.
And Dr. Bendor, we only have about 10 seconds left, but who's the best candidate? It's a young adult, ages what?
Young adults ages 17 to 26 who've been derailed by what we're talking about. The mental health, the physical health really derailed them. We want to help them get back to doing life.
All right. Thank you, Dr. Bendor, as always, for being here. Good to see you. And we want to let folks know that they can learn more by visiting instituteofliving.org/youngadultmedical. That web address is right there on your screen. We'll have another